Actually, I think it is, and I think that the government was looking at that when they crafted some of the changes, particularly in the privacy space, right? So when you look at the relaxed rules around fundraising, they tried to make it easier for organizations to do fundraising because they know how important that is. When you look at the changes around marketing and some of the clarification around that, again, they're trying to make it so that folks can actually engage in those things, but not do things that'll obviously get them in harm's way. So there are changes in the Omnibus rule that are actually designed to make things easier. Take the immunization requirement, for instance, right? Making it easier to get that information directly from the provider to the school, as opposed to having to burden mom with additional work to, for authorizations and that sort of thing. When you look at the decedent piece of it, clarifying what is, when does a decedent no longer become a decedent, right, after 50 years, and how in making it easier for folks like myself who are responsible for their elderly parents at the end of their life and taking care of them and being part of their care, can I get access to their information? In other words, is there a process in place that makes it easier for me to do that? And I think there is, as a result of the Omnibus rule. So there are parts of the Omnibus rule that I think are very much patient-centric, and they're very much a positive thing for the hospital in terms of delivering care for those folks. Well, the same thing that's good, I think they also threw some things in there that are going to make it challenging as well in terms of auditing the process and making sure that it's indeed followed. Like, for instance, the research rule. I think they simplified that in some regard with respect to multiple research projects being related to a single request, but there's going to be extra requirements on the researcher as well as the organization to ensure that we adhere to that, right? That we are honest to that process and we don't wander off and start doing research that we don't have authorization for it. So there's a little bit more oversight involved there. I think one of the biggest challenges that's going to come out of this is, even though we now have business associates liable or accountable in their own right, there's going to be greater emphasis put on the governance side as it relates to the provider. Knowing what your business associate is doing, or being aware when there's an issue and being proactive and acting on that. Well, I think the first thing is to take a look at the rules themselves. I mean, anything that's a requirement in that rule for the business associate ought to also be something that gets covered in some way in that business associate agreement. So, for instance, one of the requirements business associates have is providing PHI to HHS in support of investigations. There's nothing in the rule, though, that talks about them alerting you that they've done that, right? So if you want to know what your business associate is doing with your data, you need to make sure that you cover that in that business associate agreement so that they have an obligation to tell you anytime that they move your data, that they give your data to someone else, regardless of who it is that they're giving it to. So I think the first thing is understand what the requirements are for the business associate, make sure that those are covered adequately in terms of what you need to know about that. The second thing I think is take a life cycle approach to how you manage that vendor relationship in terms from the very get-go, where you're looking at selecting somebody and trying to understand what their capabilities are to meet those security requirements, all the way to the end where you're talking about the disposition of data at the end of the contract, right? So anything that they need to do for you on your behalf, that they're doing for you on your behalf, is there a requirement around that needs to be clarified in your agreement with them so that they know what those expectations are? Absolutely. Anytime we see more regulation and we see more specific regulation, people who aren't serious about wanting to be in that space or who aren't serious about wanting to do the right thing or cover the cost of business, so to speak, are going to elect to not take that business. So there'll be some of that, I'm sure. The biggest thing is to keep doing do the things that you're supposed to be doing anyway. You know, we've made a big deal of Omnibus, and we've made a big deal of all these changes, and when in fact what we're really talking about is tweaks around the edges, right? We've made some changes to privacy. We have fundamentally changed breach notification. You are going to need to take that more seriously, because now a breach is a breach the minute it happens, and you're going to have to prove otherwise. And so that's going to take a different approach. The business associate thing is going to take us a little bit more due diligence in terms of how we manage those vendors. But for the most part, we just need to focus on the fundamentals, the basics, right? Put a really good, solid program in place that's based on an industry standard, whether it's NIST or whatever you want to select, but something that will cover the waterfront in terms of a good, solid security program. And then as these regulations come out and as these changes come out, you're not having to change your program. You're not having to jump through hoops. It's a very comfortable adjustment to whatever the new rule is. That's where we really ought to be focusing.